Alright guys, so today's topic, interpret and apply medical terminology appropriately. You have your assignment in front of you?
Yes.
So if you have a look inside, the elements, only 3 elements. So nice and short topic, but it's a topic where it's continuous learning, probably for the rest of your life. Because medical terminology you don't learn in one day or 1 month, not even in 1 year, right?
Yeah.
It's continuous. You keep learning. Every time you find something new, you need to look at the dictionary and find out the meaning, right? So with your elements, the first element says, respond appropriately to instructions which contain medical terminology. Yeah, what does that mean? What are the key words here? Respond appropriately. Yeah, what are those times when you have to respond? Yeah, when do you receive medical terminology? When do you have to interpret and document and talk about medical terminologies? Yeah, one of those areas are during a handover. Yeah, during a handover session, people will be talking about, your staff will be talking about the client's condition, what the client is diagnosed with currently, what is the past medical history. So if you have to give good care to your clients, you need to understand what is their history. Yeah, do they have a history of hypertension? And what's the meaning of hypertension? Or do they have hypotension? And what's the difference? Hyper is high, hypo is low. Yeah, and tension is your blood pressure.
The one I read.
So guys, you can mute yourself. Yeah, so that there's no noise from homes. Yeah, if you need to talk, you can unmute. But if you go to manage participants, you can go to participants and you can mute yourself. All good? All right. So coming back, what are those areas when you need to understand and deal with medical terminologies, and how can it be, stressful if you don't understand? How can it be unsafe if you don't understand? Yeah, because you might do the wrong thing. For example, during handover, they say the client has hypotension for the last 3 days. Yeah, so immediately what should come to your mind is, okay, low blood pressure. I need to be careful when I get him up from the bed. I need to be careful when I take him for a walk because there's a chance he might feel dizzy and have a fall. So I need to take the right precautions. Yeah. So those kind of things can be a lot of, useful or unsafe, depending on whether you understand the meaning of those things or not. Yeah. So coming back to the first element, we'll go a little bit more in detail about it. Receive, interpret, and document written and oral instructions. Yeah, so you're receiving during handover. You might also receive over the phone. There might be a doctor who's giving a call and saying, can you pass this message to the nurse looking after bed number 7? Yeah, so you need to take a paper and pen and write down what's the message. In the message, there might be medical terminology, right? So again, writing it down properly interpreting, so that you don't make any kind of mistakes. Yeah, oral instructions is verbal. When you're talking to your client, or your client is asking you some questions, sometimes they know more medical terminology than you, right? Because they've had this condition for a long time, they've done all the research about it. Yeah, so if they are talking in medical terminology, again, you need to understand those things. Yeah, what's the opposite of medical terminology? Layman's terms. Yeah, layman. Layman. Layman's terms. Yeah, so instead of hypertension, what's layman's terms? High blood pressure. Hypotension is medical terminology for layman's terms, low blood pressure. Right? So those kind of things. I have a whole list of clinical abbreviations here in front of me, and we will go through a few of them that is important for your role, especially when you start going for your placement. It's good to know a few of these. Yeah, so we can write down a few of these during class today. And again, we'll go through these medical terminologies in phases. Yeah, as we go through those elements. So first half we'll discuss some, second element we'll discuss some, and third element we'll discuss some. Right? Because if we go through in one go, it's too much. Yeah, too many words. All right. So I think many of you have already done the unit healthy body systems. Yeah, because in healthy body systems, you have already learned a lot of medical terminology. Yeah, all the things related to the cardiac system. Yeah, in layman's term, we say heart. But in medical terminology, cardiovascular system. Right? So you've already been exposed to a lot of medical terminology if you've done that class, and then it gets much easier to accept it. All right, so if you've got your paper and pen in front of you, we have a few words here that we can start off with. Now, if you are also doing certificate for medications, some of the students who are doing that, again, you have your own terminologies. Sorry, guys. Yes, dear. Tell me. Yeah. Yeah, in the middle of webinar. All right. So, yeah, back to medical terminologies. Yeah, if you want to write down a few. Hepatitis. What's the meaning of hepatitis? Anything with itis is inflammation. Yeah, many of you have already heard the word hepatitis.
Yeah.
Yeah, so inflammation of the liver.
Yeah.
So if you see in your client's notes, if it says hepatitis, that means this person has got inflammation of the liver. And again, is it a history of hepatitis or is it current at the moment? Right?
Yeah.
Another word, peritoneal. Peri, P-E-R-I, toneal. Peritoneal dialysis. Yeah, you've heard about dialysis, where it's related to the kidney, and they have to do dialysis, which means they have to recycle the blood because they've got kidney problems. Yeah, they have to infuse it back into them. So peritoneal dialysis is in the abdomen.
Abdomen.
Yeah, peritoneum is a part of the abdomen. Yeah. Now, if you're going to be working in the maternity ward, you will come across, specialty words related to the, birth and all those things. So again, each unit has got its own particular medical terminologies that you have to start getting used to.
Sorry, just I have one question.
Yeah.
Yeah, this word is in the learner guide or not?
Now, these words will be in the nurse's dictionary.
Ah, okay, nurse's
Yeah,
dictionary.
so remember in class, I always encourage you to have a nurse's dictionary or
Yeah.
download an app on your phone. Free apps are there.
I
Nurse's dictionary, medical dictionary, where you can go through these words
Mm.
according to alphabetical order.
Yep. Yeah, okay.
Yeah, hemorrhage.
Hem-
Hemorrhage is bleeding. Yeah, so in layman's term, there's bleeding.
Bleeding?
Bleeding.
B.
Yeah, bleeding. BLEEDING.
Yeah, and G, okay.
Yeah, so lots of bleeding is hemorrhage,
Mm-hmm.
right? Edema. Edema can be spelled with OE or just E. Yeah, OEDEMA is edema. Also, EDEMA, edema, right? Which means swelling. Yeah, the client has edema on both legs or both hands.
Mm-hmm.
Maybe that's what they say during their handover. All right. Pulmonary, most of you know the word from healthy body system. It's related to lungs. Yeah, pulmonary is lungs. So if you hear the word acute pulmonary edema, acute means sudden, something that's severe, sudden. Yeah, acute pulmonary is lungs, edema is swelling. So you put the three words together and you interpret what it means.
Mm-hmm.
Yeah, now again, before we go forward, one of the reasons why you need to understand medical terminology is not to explain things to the clients. It's
Mm-hmm.
only for your own understanding,
Yeah.
right? So we're not supposed to be discussing medical terminology and medical situations, diagnosis, treatment, all those things with the clients.
Mm-hmm.
That's not our job. Yeah, but it's our job to understand so that we can give better care and we are safe and they are safe. All right. Then what else? Renal. Anything that you hear renal is kidney. Yeah, so if there's an abbreviation, that means a short form in your handover sheet, it says ARF. It is acute renal failure. ARF, acute renal failure. Okay. Now, in your mobility section of your care plan, you might find this word called as range of movements. Range of movements. Yeah, ROM. So range of movements is your client's moving. So moving hands up, down, yeah, moving your legs up and down. So all those things are range of movements. Can they go round about the whole hand? Yeah, so again, it's to do with exercise, what they can do, what they can't do, what they should do, they shouldn't do, right? So all those things will be detailed written down. For example, if a client has had a total hip replacement and you're working in the orthopedic ward, in the care plan, they would say, do not adduct. Yeah. So abduct and adduct. What's the meaning? Abduct means away from the body. Adduct means towards the body. Yeah. So in your care plan, it will say do not abduct both the legs. That means don't cross the legs. Yeah. Keep it open like this. So they should not cross their legs. Otherwise, that could be, not very good for their hips after surgery. Yeah. So abduct, AB, like abduction. Yeah. AB, DUCT. Abduct is away. Adduct is towards. All right. And then cardiovascular disease. Yeah, so CVD, cardiovascular disease. So lots of conditions related to that. And again, when you have done your healthy body systems, you've studied the parts of the heart, yeah, atrium, ventricles, right? So related to that, again, there could be more medical terminology you'll see in that client's notes. Right? Abdomen. So, with your healthy body systems, we studied about stomach, small intestine, large intestine. Yeah, so your abdomen is a whole area where you have all your organs related to your gastroenterology. Yeah, anything related to your stomach and intestines. Yeah, all the process related to digestion. So all of that is gastroenterology. Now, tender. Tender means, is it painful? Is it sensitive? Yeah, is it soft and tender or is it hard? Yeah, so again, in your handover, they might say the client's abdomen is very tender. Yeah, so that means you need to be careful. Don't touch that area. It's painful for them. Yeah, tender, Tender. Yeah, cardiovascular, you'll hear the word tachycardia. Tachycardia means very fast. The heart rate is going very fast. And the opposite is bradycardia. That means very slow.
What's that mean?
Tachycardia, Tachy, cardia, Cardia. Yeah, tachycardia is too fast. The heart beats too fast. So above 100 beats per minute. And bradycardia, Bradycardia. Bradycardia is too slow. Yeah, so below 50 beats per minute. All right. Now, some of your clients may be on a alcohol withdrawal scale. Yeah, maybe they've been having alcohol regularly for a long time and now they're admitted in the hospital. So they might have withdrawal symptoms because they're not allowed to drink in the hospital, right? So they might put a form called as alcohol withdrawal scale to see how is their behavior. Is there any changes in the vital signs, in their behaviors due to not having alcohol, right? And this might be clients in any ward. Yeah, any questions so far, guys? You can unmute yourself and talk if you have any questions. Yeah, bipolar disorder. Yeah, that comes under your psychiatry. So again, you might have clients in any ward with a history of bipolar. Yeah, now when we say history, it doesn't mean they don't have it right now. They might still have it now. Yeah, but it's been there in the past as well. Yeah, but it's under control. Right? That's not the main reason why they're admitted to the hospital right now. Yeah. All right. Now, below knee amputation and above knee amputation. What does that mean? So if you're working in the orthopedic ward, you will see this a lot. Below knee amputation means below the knee, the leg has been amputated. Amputed means cut off. Again, these are all medical terminology, and layman's term is cut off. Yeah, so amputation above knee means on top of the knee, it's been amputated. Yeah, BGL, during your vital signs, you studied about this. BSL and BGL, it's the same thing. Blood glucose level or blood sugar level. All right. Bowels open. Bowels, BOWELS. Bowels open. Bowels not open. Yeah, so your abbreviation will be BO, bowels open. Bowels not open, BNO. Yeah, that means a person is not past stools. Yeah, bronchitis. Bronchitis is inflammation of the bronchus. Yeah, so in your healthy body systems, you studied about respiratory system, where you've labeled bronchus for those little balloon-like things in your lungs. Yeah, bronchus, bronchioles, when they get inflamed, when they get blocked. Yeah, lots of coughing, that's bronchitis. Pneumonia, everybody's heard about that. Yeah, pneumonia, where the lungs are affected. Yeah, BP is your blood pressure. Hypertrophy. What does hypertrophy means? Hyper is HYPER. Trophy is TROPHY. Trophy. Hypertrophy means it's getting bigger. Yeah, so BPH is benign prostatic hypertrophy. Yeah, again, in your reproductive system, we talked about this. Prostate for the men, prostate gland. Yeah, which is very close to the bladder in the pelvic region for the men. Yeah, and that particular gland starts getting bigger in size. Yeah, mostly happens with older people. Benign prostatic hypertrophy. Yeah, breast cancer. Now, another word is bowel sounds. Yeah, very important and very commonly used. Bowel sounds. So if your client has come back from surgery, you know, one of your post-op instructions is you can start your client on light diet when you can hear the bowel sounds. Yeah, which means you need to be able to hear the sounds from the abdomen, the gurgling sounds. That means the abdomen is started to work. It's, it's recovered from the anesthesia. So you have to wait for a few hours before you start giving them some light, something to eat and drink. Couple of hours. So you have to ask the question to your clients, can you feel your bowels are moving? Can you hear some sounds in your abdomen? And if they say no, then they actually check it. They use a stethoscope and you can check and see if you can hear those sounds. All right. Now, body weight. Body weight just means weight. Yeah, but in medical terminology, they use that so that don't get confused. It just means check the weight. Yeah, in the babies, they will say birth weight. Yeah, birth weight means at the time of birth, because a few days later they will lose weight and then they will gain weight again. Yeah, so for babies it's different. Birth weight and current weight is different. But for adults, they just say body weight. Yeah, biopsy. Many people have heard about this word. Biopsy, it's related to, when someone has probable chances of having cancer, they do a biopsy. They send the specimen to the laboratory to check the results. Yeah, so basically taking some amount of cells from that cancerous growth is biopsy. All right, carcinoma. So when we say cancer, the full word is actually carcinoma. Yeah, so if you hear this word carcinoma, it just means cancer. All right. Now, if you're working in the cardiac ward, you will hear this word CABG. And in healthy body systems, we've talked about this already. Coronary artery bypass graft. Yeah, do you remember that? Coronary artery bypass graft. Now, when you work in a hospital or nursing home, you will come across this term called as CALD. CALD. Yeah, CALD. Not cold, CALD. Yeah, CALD means culturally and linguistically. Linguistic means language. Culturally and linguistically diverse. Culturally and linguistically diverse. Yeah, which means this particular facility has got people from different cultures and different languages. All right. Now, CALD also has another meaning. Yeah, sometimes there are two words with the same interpretation or abbreviation. So CALD also means chronic alcoholic liver disease. Chronic alcoholic liver disease. All right. Cardiac ward is also called as CCU, Coronary Care Unit. Coronary Care Unit, CCU. Yeah, now maternity ward, you'll hear the word cesarean section. CS is cesarean section. And you'll also hear NVB, normal vaginal birth. Normal vaginal birth. Yeah, so CS and NVB. Yeah, so in your handover sheet, it'll all be abbreviations. Yeah, because they don't have time to write the whole, the whole word. It's too much. So most times they just use abbreviations and they expect you to understand those abbreviations. Yeah, you have your ECG, which is also part of cardiac ward. ECG. Yeah, ECG is electrocardiogram. Yeah, anything you hear the word chronic. Chronic is related to long term. It's been there for a long while. That particular disease has been there for a long time. Yeah, another word related to cardiac is congestive cardiac failure. Congestive cardiac failure. Yeah, called as CCF. Congestive cardiac failure. Yeah, if you hear the word congenital, that means it's been there from before birth. Before birth. Or right from the time of birth, this child already had this problem. Congenital. Yeah, congenital cardiac problems. Yeah, that means right before birth it started. Yeah, if you hear in your diet notes, clear fluids only. Yeah, that could be one of your dietary instructions, clear fluids only. That means this client is only allowed to have clear fluids, something that you can see through. So for example, the client can have black tea, you can still see through it. Yeah, that's clear. They can have some soups that is clear. You can see through. Nothing which you can't see through. Right? So clear fluids. Yeah, some clients have got something called as chronic fatigue syndrome. Chronic fatigue. Fatigue means tired. They always feel tired. Chronic fatigue syndrome. Yeah, we already spoke about congenital heart disease. We just talked about that. It's also called as CHD, congenital heart disease. Yeah, in the cardiac ward, you'll hear another word. It's called as congestive heart failure. Congestive heart failure. Yeah, if you're going to be working in the neurology ward, yeah, you will find a lot of people with accidents, trauma to the brain. So one of the common words you'll hear is closed head injury. Closed head injury. That means the head is fine. Outside, nothing has happened. But inside, they've got injury. Yeah, if you hear the word contraindication, contraindication means you should not be doing it. Yeah, this food is contraindicated. Yeah, that means sugar is not the right food for diabetic. It's contraindicated. Yeah, or this medicine is contraindicated. Maybe because the client is pregnant. This medicine is not suitable for her. Right? So contraindicated. That means not, not allowed. Yeah, not recommended. Now, change in bowel habits. Change in bowel habits. That means maybe the client was, normally they pass stools once a day. Yeah, but now it's been 2 or 3 days. They're not able to pass stools. Or maybe it's the opposite. Could be diarrhea several times a day. Yeah, so change in bowel habits. So again, when you use medical terminology, these are professional words. So if you're handing over to someone, instead of saying, oh, the client is passing 2, 3, 4 times, right? That doesn't sound very professional. So you say there has been a change in bowel habits. The client has had diarrhea times 2 or times 3. Yeah, so if you hear those kind of words, that's the interpretation. That's what it means. All right. Chronic kidney disease, chronic kidney disease, or chronic renal disease. It's the same thing. Yeah, because renal is your kidneys. So in some places they might say chronic kidney disease. Chronic liver disease. Chronic liver disease. Yeah. Leukemia is a form of blood cancer. Leukemia. Yeah, again the spelling Leukaemia. Leukemia. Leukaemia. Yeah, clinical midwife. Clinical midwife is the person who looks after the maternity section. Yeah, just like you have your registered nurse who looks after your other units. You have a registered midwife, also called as clinical midwife. Yeah, now there are specialists as well. So they're called as clinical midwife specialist. For midwifery, clinical midwife specialist. For nursing, clinical nurse consultant or clinical nurse specialist. Yeah, so your short form is CNC or CNS. Yeah, so during handover, they might say, oh, the client has got, the wound has become really bad now, you need to contact the CNS. That means contact the wound specialist or the clinical nurse specialist.
Mhm.
Yeah, then if there's any kind of education requirements, you have a clinical nurse educator. Clinical nurse educator, she will educate both the clients as well as the staff. All right, another common thing you will hear is COPD. COPD. Yeah, that stands for chronic obstructive pulmonary disease. Chronic obstructive pulmonary disease. CPR, everyone knows CPR. Those who've done first aid definitely should know that. Cardiopulmonary resuscitation. Yeah, CPR, cardiopulmonary resuscitation. Colonoscopy. Yeah, we spoke about this, healthy body systems, where they put a tube with a camera down through the anus, through the colon, to visualize, to see if there's any kind of growth, bleeding, any signs of inflammation. Yeah, generally to detect bowel cancer. Yeah, so that's colonoscopy. All right, so we'll take a break from these abbreviations for now and get back to your elements, and then we'll continue again later. All right, so can you guys unmute yourself and speak a little bit about what's going on? Are you guys okay?
Yeah, I am.
Yes.
Yes.
Miss G, are you listening me?
Yes, I can hear you.
Oh, that's good.
All right. Yeah, everyone okay with this unit?
Yeah.
Too many new words.
Yeah, I haven't done healthy body systems yet, so
Okay.
everything seems new, but it's okay. I guess
Yeah.
I'll catch up.
Exactly. Yeah. So in that particular unit, you will, get a lot of exposure. And again, we have a video for healthy body systems. You can get the link from the office for that video.
Okay.
And you can, watch it again for the next 30 days. It will be active.
Okay.
Yeah. So that helps you to learn a lot about the different words related to the human body systems.
Okay. Thank you.
Yeah. Any other questions, guys, so far?
No.
All right. Yeah. So again, those who are doing this, being exposed to medical terminology for the first time, do not stress. It's a lifelong process of learning.
Mm.
Yeah, I know it can be overwhelming with all these new words. It's like a new language.
Yeah.
Exactly.
Yeah, so we have to take it easy and learn little by little. Yeah, so every day you can go through your medical dictionary or nurse's dictionary and learn a few words, right?
Yeah.
We'll get back to the first element. Um, some of the points for the first element. Let me quickly read through it. Written and oral instructions. Yeah, so written instruction is your care plan and your handover sheet. Yeah, this is what you get before you start your shift. Your care plan has got in writing, in short, yeah, abbreviations about your client's name, room number, which doctor they're under, what's their current treatment, what's the current diagnosis, and past history. Right? In your client's current or past, they will also write any kind of infection status, something that you need to be careful of if required. Yeah, and that's why they use the word contact precautions. Yeah, contact precautions or universal precautions. So if you hear these words or you see this in your client's written information, you need to understand that you have to take precautions with
Yeah.
this client.
Mm.
Yeah, maybe he's got MRSA or HIV or anything. Yeah, and then it's your responsibility to get additional information about this client. Yeah, because in the handover sheet, they won't write all the details. Yeah, because it's against the client's privacy and confidentiality. All right, so oral instructions, time and again, the staff might come and talk to you about some changes, or like I said earlier, you might get a phone call. Yeah, so all of those are part of your verbal instructions. Yeah, passing information on. This is one of our key things that we do with our profession because we have shift work. Yeah, morning shift, they hand over to evening shift, then evening hands over to night shift again hands over to morning shift. So we have to be careful about passing information correctly to the right person about the right person. Yeah, medical terminology. So we started off with a few. Abbreviation means short forms. Can everybody see the screen that I'm sharing?
Yes, medical terminology.
Yeah. So abbreviations are short forms. Yeah, common medical conditions, departments. Yeah, different departments. Like we said, ED is emergency department. ED, emergency department. ICU, intensive care unit. Yeah, OT, operation theater. OT, operation theater. Then you have DSU, day surgery, day surgical unit. Yeah, day surgery. Yeah, then you've got CCU, coronary care unit or cardiac care unit. CCU. Yeah, so the word coronary means cardiac. Yeah, which means related to the heart. Yeah, then you've got your maternity ward. Yeah, antenatal and postnatal. Antenatal means those before birth, postnatal after birth. So different wards. Antenatal unit, postnatal unit. Yeah. Then you've got your orthopedic ward, all the cases related to bones. Your surgical ward and medical ward. These are two separate wards. Medical ward, all the medical cases. Surgical ward, anything related to surgery. So depending on which facility you're working in, these are at least the basic wards. And then some of them have more specialities like pediatric ward for children, pediatric ward. Some hospitals have got stroke unit, especially the public hospitals. Because otherwise, if it's a small hospital, it'll just go under surgical or medical. But if it's a bigger hospital, they'll have more specialities like neurology ward, spinal ward, stroke unit in big public hospitals. There might be a burns ward or burns unit, psychiatric unit. Right? Yeah, then each hospital, they've also got their maintenance department, housekeeping, diet department, yeah, waste management section, pathology department where they collect blood, radiology where they do x-rays, MRI, all of that. Yeah, in bigger hospitals, again, they'll have separate endoscopy unit. Endoscopy. So endoscopy is both colonoscopy and gastroscopy. Right? So these are some of your departments or sections in a hospital. Health insurance terminologies. So again, do you know if your client is requiring a private room? Yeah, sometimes they have all these rules and regulations related to insurance. Yeah, if they have private health insurance and if there's a spare empty room, they can have that. Yeah, because that's their arrangement. So all those things related to health insurance terminologies. Yeah, Medicare terminologies. It's more to do with accounts and admin. Yeah, interrelated functions of the body, locations, and disease. Yeah, all the different functions. That's why we do the unit, healthy body systems, to study the structure and the functions of the healthy body systems. Yeah, so when we talk about body system, there are two. One is the healthy and the other is unhealthy, which is disease conditions, right? So in order to identify what is unhealthy, you need to know what is healthy. Yeah, and that's the whole point why you learn that unit. Yeah, healthy body systems, to identify what is unhealthy or abnormal, so that you can, you can talk about that to your supervisor. All right. Yeah, next one. More medical terminology, knowledge of medical specialties, and the names and titles of doctors working in specialist fields. Yeah, remember we spoke about this? Yeah, dermatology is to do with skin. Yeah, and skin is called as integumentary system. Yeah, so this is just a refresher now of healthy body systems, what we have already covered. Yeah, what else? Medical specialty. Your cardiac ward is your cardiologist or cardiac surgeon. Yeah, cardiologist will diagnose, cardiac surgeon will perform the surgery. Yeah, neurology department, neurologist or neurosurgeon. Yeah, orthopedic ward, you have your orthopedic surgeon. Right? Yeah, obstetrics and gynecology. What's the difference? Obstetrics. Obstetrics is to do with birth. Yeah, that's why they call them obstetrician. It's a difficult word. Obstetrician. OBS. Obstetrician is to do with birth of the baby. Gynecologist is to do with anything abnormal with the female reproductive system. Gynecologist. Right?
Yes, miss.
Yeah, what else? Medical specialties. Yeah, titles of doctors. Yeah, so for each and every healthy body systems, we've gone through the names of those doctors and the specialties. So yeah, please go back to your notes and have a look at that. Yeah, medical conditions. So some of the things that we were just discussing. Itis. Anything with itis means inflammation. Yeah, bronchitis. Arthritis. Yeah, so those kind of things. Again, write a list of that or go through your dictionary to learn more. Medical equipments and instruments. Yeah, so you will be using a lot of things. One is your ECG machine. Yeah, so AINs, they do ECGs if they are working in the cardiac ward. If you're not working in the cardiac ward, you don't have to be doing that because it's not something commonly done in other wards. Yeah, so ECG machine, then you've got your bladder scanner, yeah, you have your blood pressure machine, thermometers, yeah, blood oximeter, your oximeter. If you've done vital signs, you know the oximeter, you put it on the finger to see how much of oxygen is in the blood. Yeah, it's also called as pulse oximeter. Pulse oximeter because it also counts the pulse or the heart rate. Yeah, remember pulse and heart rate, it's the same thing. Pulse and heart rate. So pulse oximeter. Yeah, you might need, if you're working in neurology ward, you might need a pen torch to see the pupils. Pen torch. So there's a light coming out of a little pen. Yeah, so different wards, you might have different equipments that you need to get familiar. Medical investigation and procedures, depending on which ward you're working. Like I said, if you work in maternity ward, you have to know, is it CS, cesarean section, or is it normal vaginal birth? Right? Because according to that, you have to give different kinds of care. Yeah, other investigation and procedures is your blood test, urine test, blood glucose checks. Yeah. So if your client is having a blood transfusion, yeah, one of the things that will be handed over to you is, can you check the vital signs as per policy procedure? Yeah, so there is a policy procedure for checking vital signs for your clients who are going through blood transfusion, which means if it's just started, then you check it every 15 minutes for the first hour. Then you check it every half an hour for the next hour. And then you check it every hour for all the following hours. Right? So this is not just for blood transfusion, but it's also for those clients who've come back from surgery, from any surgery. Yeah, if they've come to your ward, that's the policy procedure. You have to check your vital signs, regularly as per policy procedure. All right, Medicare terminology. Medicare is, like we said earlier, regarding your accounts department, anything for them to do their billing and stuff. So if that's the area you're working, you need to get more familiar with those words. Medications. Now, since you're not going to be doing medications, you don't have to worry too much about medical terminologies related to medication because it's a whole, lot of, separate terminologies. For example, if your client's note says OD, it means once a day. OD, once a day. BD, twice a day. Yeah, B for Bob. So BD, twice a day. TID, 3 times a day. Yeah, so your medical terminology has got a lot of Latin words. Yeah, many of those words are not English, it's Latin. Yeah, so again, those need to be by-hearted by those people who are giving medications. Yeah, because they have to interpret it on a daily basis. Yeah, if you hear the word stat, S-T-A-T, stat, it means immediately. Yeah, so for example, if there's a phone call and the doctor says, you know, bed number 7, they need a liter of normal saline stat. Stat means immediately, right? So when it comes to medications, if there's any phone order, it has to be listened to by 2 nurses. Yeah, so your registered nurse might, you know, receive the order and then she'll pass it on to you or any other nurse so that they both can listen to the same order, clarify and sign, right? So certain medications has to be listened to by 2 registered nurses. For some other, it can be enrolled nurses. Yeah, but if there's nobody, you know, it's definitely better that they get you to hear it than nobody else, because that's a law. There has to be 2 nurses to hear a phone order to avoid mistakes. All right, referrals. So we speak about referrals a lot in class. If your client has any issues, we don't give them any advice. We refer them to the right person. Yeah, so if they're talking about any questions they have related to their medical condition, you refer them to the registered nurse. And the registered nurse, if they can't help them, they refer them to their doctor. Yeah, anything to do with mobility, refer them to the physio, diet, dietitian, anything to do with spirituality or religion. They have their own chaplains for different religions. Anything to do with legal matters, it's a lawyer. Yeah, so likewise, psychiatric problems, you know, they could be a counselor or a psychologist. Yeah, so that's your referrals. Terms to describe onset or nature of the disease. Yeah, so these terms, we spoke about this, acute and chronic. These are the terms that you know, when did it start? Acute means started, you know, very shortly, and severe. It was not there for, you know, long time. The client has fever, that's acute, right? The client has severe bleeding, severe pain. Yeah, so these kind of things you need to be observing and documenting as well as reporting. So we need to write the correct terms. The client complained of severe shooting pain in his chest. RN has been notified. Right? So those kind of things is what you would document. Anatomy and physiology, we won't go through that. As you see here, all the different body systems, musculoskeletal, cardiovascular, respiratory, endocrine, digestive system, urinary system, reproductive, integumentary, and lymphatic. Yeah, so please go through your unit, Healthy Body Systems. You have your learner's guide and plenty of medical terminology in there. Yeah, respond appropriately to instructions which contain medical terminology. Yeah, using checklist where appropriate. Yeah, so checklist in your hospitals, they have something called as pathways. Yeah, pathways, pathways. Yeah, pathways are also a checklist where you have, just like you see on the screen, you have a list, but on the top you have the heading. Is it day 1, day 2, day 3? Yeah, is it before surgery, on the day of surgery, right? So all those things will be the heading, and then you have a list of things to do for that person, and you might have 3 columns. Yeah, AM, PM, night. Yeah, so AM is everything that has been done during the morning shift, PM, evening shift, and ND is night duty. Yeah, so night shift, whatever you've done, you have to tick. Now, in most hospitals these days, instead of ticking, they want you to sign or put your initials in the boxes, because anybody can tick, but they want to identify who exactly has done it. Yeah, so they want you to put your initials. So just follow wherever you're working, whatever is their particular way of doing things, you need to follow those things. All right, so that's about checklist. Yeah, types of checklist, many different types of checklist, and pathway is one of them. Yeah, the whole idea is that you have a list of things so you don't forget what to do for that particular day. But when it comes to patients, they can always be variables. Yeah, variables means something that is different, not part of expected normal checklist. Yeah, for example, maybe the client has got behavior issues and they're not cooperating. You're not able to do what you're supposed to do. Maybe the client is too weak and certain things are not done, what was supposed to be done. Yeah, so under your pathway, you've got a space called as variables where you write down what are those variables. And in your box, instead of writing your initials, you write V. V is variables. That means it's not done, please refer to the notes. Yeah, and in that pathway, if you don't have enough space, you're expected to write more details in your progress notes. Right? So you write in short in the pathway, and in the progress notes, you write more details. All right. Medical equipment checklist. Yeah, so for example, in your emergency trolley, yeah, which is everybody's responsibility to look after it. There's a trolley called as emergency trolley, which is the first thing you pick when there is a code blue. Code blue is a medical emergency. So you have to go and bring your medical emergency trolley to that particular room where there's a code blue. Right? So yeah, medical equipment checklist will be on that emergency trolley, all the list of things. So the top half of it has got all your adult equipments. The bottom half has got your pediatric equipments. Everything that a person needs in case of emergency should be in that trolley. Yeah, and that trolley is checked every shift. Yeah, and there are different people who are given the responsibility of checking it, but it has to be checked so it's ready for any emergency. Yeah, so they go through the list and they see if it's done and they sign that it is there. So every day it is signed, dated, and the time should be written. All right, so likewise, many different types of checklist. Respond appropriately to instructions containing medical terminology. So here we're talking about interpret abbreviations for specialized medical terminology. Yeah, which is all the examples that we were talking about so far. Common abbreviations. Yeah, means short forms. Acronyms. What is the difference between abbreviations and acronyms? Right? Abbreviation is short form. For example, patient is called as PT. Yeah? Or client is called as CT as an abbreviation. But in the hospitals, we still say PT for patient. Yeah, now doctor is DR. The registered nurse is RN. Yeah? So those things are short form, abbreviations. Now, acronym is each alphabet means a certain thing. Yeah, like RN, registered nurse, is a proper abbreviation as well as acronym. But PT, patient, is an abbreviation. It's not an acronym. Yeah, so you get the difference? Abbreviation is just a short form. But acronym has a meaning to each word of that short form. Yeah, like WHO, World Health Organization. That's an acronym. All good?
Yes, miss.
Interpret and adhere to the policy and procedure of the workplace. Yeah, so like I said earlier, different workplace, they've got different policy and procedures. It's your job to understand it. And adhere means follow. Yeah, follow those, because if you don't follow, that creates confusion to other people. Yeah, and seek clarification when necessary. That means if there's something you don't understand, you need to check with the right person. All right, lots of policy procedures related to medical terminologies. You might see some medical terminologies in emergency procedures. For example, like I just mentioned, code blue. Code blue. Blue like the color blue. Right? That means medical emergency. Yeah, code yellow. Yellow means internal emergency. Yeah, that means internally something has happened. Either, the phones are not connected or the electricity is gone off, something like that. The plumbing, there's a problem with the plumbing, right? So anything internal is code yellow. External emergency is code brown. Yeah, code brown, external emergency. Code black is some kind of assault or threat. Threat or assault. That means either there's a fight or a big argument or some major problem between two people in that facility. It could be physical, it could be something violence related. Yeah, that's code black. Yeah, code purple. Purple means there's some kind of a bomb threat. Yeah, bomb threat. Code purple. And code red is fire. Fire. Yeah, any emergency related to fire, like maybe evacuation, those kind of things. So they might announce there's a code red on level 3. Yeah, code red on level 3. That means on the 3rd floor, somewhere there's an issue related to fire or smoke. All good?
Yes, miss.
So those are your things related to emergency procedures. Likewise, every single thing that you do, there are policy procedures. Yeah, additional training. So when you start in a new place, they will have orientation. They will orient you to that hospital. They'll show you all the different departments, introduce you to all the different people. They'll go through what are the common, abbreviations that they use in that place, right? All those are part of additional training. And also most places, they've got 3 days supernumerary. Yeah, 3 days supernumerary means you work with somebody for 3 days. You don't take your own patients alone. Yeah, so just so that you get used to that place to avoid any kind of mistakes. All right. And all these additional trainings are based on legislation, that means laws or best practice. Yeah, so that's why it's different in different organizations. It's not always the same. They do what they think is best for their facility. All right, any questions so far? All right, coming to the second element. Yeah, second element is carry out routine task. Yeah, so what are your routine tasks for morning shift? It can be different for your evening shift and different for night shift. Yeah, so certain things you will have medical terminologies. They might say activities of daily living, ADL. Yeah, that's a medical terminology. You will read that during, when you're checking your client's file, going through the care plan or the progress notes, you'll see this word. Client is independent with activities of daily living. They won't write the whole thing, they'll only write ADL. Yeah, which means you didn't have to do much to help him. He's quite independent to do his activities of daily living, like the showers, feeding himself, dressing, undressing, going to the toilet by himself. All those things are activities of daily living. So routine task in the morning, as you know, it's the busiest shift of all because there's so much to do related to ADL. Yeah, so clients having their breakfast, sitting them up properly for breakfast, making sure that they're eating it safely, they're not choking. Are they able to hold the spoon and fork in their hands? Is it hard for them to feed themselves? Right? So all those things related to ADL is done in the morning. Then in the evenings, yeah, generally it's more to do with monitoring your clients, more to do with maintenance of the area, like restocking, tidying, organizing your unit. Yeah, plus whatever assistance your client requires. That's why there are very few AINs in the hospital in the evening shift. Most of them are required during the morning shift, right? And night shift, even less. So very few AINs at night because most of the clients are sleeping unless there are some clients with, behavior disorders and they need specialing. Yeah, specialing is another medical terminology, which means This person requires special attention, one-on-one from your staff. So they will have an AIN sitting with the client in their room, specialing them. Yeah, so those clients with behavior disorders, psychiatric problems, dementia, suicidal tendencies, right? Those of the, those clients will require specialing. Yeah, consequences of using incorrect medical terminologies. Yeah, you might order the incorrect supplies. Yeah, so for example, in your unit, you have a storeroom where you're supposed to be checking, what are the things that is low on stock so that it can be ordered. So if you just write TED stockings, that's not enough. You have to write which shape, which size. Yeah, because TED stockings come in many shapes and sizes. So if you just write TED stockings, they might order a large amount of stockings that you already have. Yeah, so you have to write exactly which one. TED stockings, medium, below knee. Yeah, or regular size. Yeah, whatever is low on stock, you need to write it very, very clearly. Yeah, labeling the medication can be wrong, and therefore patients might receive wrong medications due to incorrect medical terminologies. For example, you have a medication trolley where medication are kept. And in most places, it's categorized. Like, for example, analgesics. Analgesics means painkillers. Yeah, all the analgesics are kept in one place. Yeah, all the medications for bowels are kept in another place. So if the labeling is not, like people might put it in the wrong place after giving. And therefore, there could be some errors, because the nurses didn't check it properly or didn't keep it back in the right place. Yeah, medical staff could receive wrong information about patients, which could cause delay in diagnosis and wrong treatment. Yeah, so that's why before we file anything in anybody's file, we always put the client's name, the sticker on each and every page. Yeah, because you might get a fax of your client's investigations, yeah, related to their blood test. And if you put that in the wrong client's file, that could be causing a lot of problems. Yeah, because wrong diagnosis, some results related to some other clients, right? Now that could result in the doctor prescribing the wrong medication for them based on those investigations. Yeah, so these kind of things do happen. Giving the wrong information to clients and their families could cause unnecessary distress. Yeah, a lot of stress. Right? Because it's nothing related to that client at all. Seeking assistance from your supervisor. Yeah, so we spoke about this, that if you want to clarify something, you can either do it in person or electronic communication or media, such as what we're doing now. It's always better to clarify things. Ethical dilemmas, yeah, which means confusions. Yeah, what do you do when there's two set of values? You need to decide which is more important in that situation. Right? We talk about this in other units, ethical dilemmas, Legal and ethical, have you done that unit? Yeah, if so, then you already know about this. Yeah, ethics, which means values. So again, your profession has its own ethics. Yeah, code of conduct. That means what should be your professional behavior? How should you behave? And if you have any dilemmas, that means confusion related to these ethics. So for example, your client's family members saying something, but your client wants something else. So whom do you listen to? Yeah, so that can be sometimes confusing, but you always listen to your clients first. They are the priority. Yeah, now third and final element. Use appropriate medical terminology in written and oral communication. So using it appropriately, start using it wherever you work. Oral communication, answering routine telephone inquiries, communicating with a range of medical hospital professionals on patient-related matters, confirming appointments, dealing with difficult patients, paging staff members. Yeah, we still use pagers in the hospital. Reporting to staff at meetings, transferring calls, and verbal instructions. Right? So these are some of those areas. Altering communications. You will have to alter your communication slightly when dealing with different people and situations. Yeah, fellow workers will have a much better understanding of medical terminology than patients or their families. So it's always better that you talk in layman's terms when you're talking to your clients or their families, because you don't want them to get stressed out with new words and get more confused. Yeah, teamwork and multidisciplinary team. Undertaking work in a multidisciplinary environment involves working alongside people with different expertise and within different departments. This is the case in healthcare profession. A greater cooperation is therefore needed to be able to achieve the required goals. Yeah, attempts should be made to understand other departments' roles and needs. Right? So cardiac ward, if you need to borrow an ECG from the cardiac ward for your ward, your RN has asked you, can you please go and get it from the cardiac ward? Yeah, so there is a process to do that. You need to first call and check with them in their reception. Do you have your ECG? Is it in working condition? Can I borrow it? Yeah, and you have to tell them which ward you're calling from and who you are, right? So your name, your title, and which ward. Now they will say yes or no. Depending on that, you go and get it. But they also have a book where you need to write down your details and the time, what time you're borrowing it. And when you finish, making sure that you go and return it as soon as possible. Yeah, because they might require it all the time and much more often than other units. So we don't want to be causing any kind of delay, right? So understanding what is their role, what is their need, and doing what needs to be done. Yeah, use appropriate medical terminology in oral and written communication. Yeah, so sometimes you might have to verify some things. For example, there might be a signature which is already done in your section and you haven't done it. So you need to check with your supervisor, like, this is done. Do you think it's a mistake done by somebody? Or has it already been done? Should I do it again? So those kind of things. Yeah, you need to always consult your supervisor. Because human error, sometimes mistakes do happen. Yeah, accuracy and checking information, read it carefully. Ask if you're unsure, try to learn common abbreviations so it gets more and more easier for you to interpret the documentation. Do not rush. If you rush, you might miss something. Yeah, you might make a mistake. Yeah, verification. So sometimes you can't understand the handwriting of people. You need to clarify those things, right? Sometimes you didn't hear properly what they're saying. You need to say, you know, sorry, I can't understand. Can you please repeat? Yeah, so there's absolutely no shame in doing those things because you're doing it for safety reasons. Spelling and pronunciation. Yeah, when we talk about medical terminology, you know, like you've already experienced, some of the spellings are very different and difficult. Yeah, some of them have two different spellings because you've got British and American English, where the spellings are different. And the same thing with pronunciation. So different people, depending on their accent, might pronounce it in different ways, right? So we need to try and learn the correct ways. All right.
Gia, what is that app called?
The app is your nurse's dictionary.
So the app's called the Nurse's Dictionary.
Yeah.
Okay, thanks.
So if you go to your app store, you'll find plenty of them. You can choose whichever one you want. Preferably something Australian is more better.
I have an Oxford Dictionary of Nursing.
Yeah.
I think I just got that from a normal bookstore like QBD or
Yeah.
DMIT.
That's fine.
Mm.
Absolutely fine to use that. Yeah, prefix and suffix. Yeah, so prefix and suffix is to do with words that are used before and after. Yeah, so in your assignment, you've got an activity related to that. Yeah, common prefixes. So anything before the medical terminology is a prefix. For example, the letter A or AN means without, without. Yeah. Anti, anything with the word anti means against. Yeah. Contra also means against. So you have this on page 65 of your learner's guide. Yeah, so you don't have to write it down. If you go to your learner's guide, page 65 and 66, you'll find a whole list of common prefix and suffix. Yeah, so prefix is before, suffix is after the word. Yeah, like we talked about abduction. Abduction means away from the body. Adduction is towards the body. All right. So please have a look at that, page number 65 for those words, and complete your activity, which you'll find in your assignment related to that. Yeah, suffix. Coming to suffix, if you hear the word ectomy, ectomy, hysterectomy means what? Removal of the uterus is hysterectomy. So anything ectomy means removal. Yeah, any word or suffix at the end. Yeah, itis is another suffix which means inflammation. So you have the word and then itis, inflammation of that organ or that system. Yeah, pathy means disease. Pathy. All right. So please have a look at that. Page 66 for your common suffix. Yeah, and then on page number 64 of your learner's guide. Yeah, if anybody is new to class, your learner's guide is already emailed to you. Please have a look in your email. For today's unit, you've got 68 pages of information. So if you go to 3.4 of your learner's guide, you'll find there's a table which talks about pronunciation. Yeah, pronunciation. So for example, if there is a C before A, if there is a O, if there's a C before a, O, and U, it is pronounced as K. Yeah, like here, coroner. See the C before O. We don't pronounce C, we say K. Right? And again, you don't have to by heart these things. It's just for you to be aware that, you know, English is a funny language. It's not exactly as it is spelled. The pronunciation is different. Yeah, if there's a C before E and I, it's called or pronounced as S, like celiac or cirrhosis. Yeah, you see that? Celiac or cirrhosis. Yeah, if there's a CH, it's again pronounced as K, like cholera, cholesterol. Yeah, G before E and I is pronounced as a J, genetic, genetic. So although it's with G, it sounds like J. Yeah, PF is pronounced as F, like physiotherapy, physio, like a F, not P. Yeah, phobia, not P, sounds like F. Yeah, PN is pronounced as N, that is pneumonia. So P is silent, we don't say with P, just pneumonia. All right. So likewise, on the other page as well, you've got a few. That's page 64, 65. You can see some words related to pronunciation. Yeah, and then lastly is your projects. Yeah, so project 1. What does project 1 say? Regarding research related to three different units. Is that right? Someone wants to read your project?
research and write the medical terminologies and abbreviations that apply to orthopedic unit, maternity unit, and cardiac unit.
That's right. So please research about these 3 units and what are those terminologies specific to these units. Yeah, and then your project 2. What does project 2 say?
One, it says describe the Freedom of Information Act and its impact on your work.
Yeah.
Then 2, research, draw, and explain the meaning of 5 or more commonly used safety signs or symbols used in the hospital.
Yeah.
Then 3, e.g. biohazard, caution radiation area.
Yeah, examples.
Oxygen in use.
Yeah, all those are examples, right?
Okay.
Of those signs. Yeah, so those are your 2 projects.
Sorry, Gia.
Yeah.
So for number 2,
Yeah.
we pick 5 from number 3. 5 examples.
Yeah.
Yeah.
Does it say 5?
Yeah, it says draw and explain the meaning of 5.
Okay. All right.
More, I guess, or more if you want.
All right.
5 or more.
Sure.
Okay.
All right, guys. So that's about your unit for this topic. Right on time, because this session is, going to be finished soon. We have a few minutes before 12. Any questions so far?